Okay, it's Dr. Buford here. We're just getting started on this right knee, and I think you can see what the problem is right out of the gate. This is the tear right here, and let me show you what a normal meniscus looks like. This is normal up here, so we're good here. All the way in the front, we're good. Normal, normal, normal. You can see the joint capsule here that has the vascularity in it. And then when we get back here to the posterior horn, I'm just rotating the camera. There we go. There we go there. We'll get another probe. Um, that's where the tear starts. And so the issue is, okay, sorry, we're back. And with the probe, we got to get a little longer probe. So with this little bit longer probe, we can see the little split in the meniscus here. And it came from underneath right here. You can see this kind of split in half. So the meniscus gets pretty thin right there. But the big issue is it attached in the back? And it is. So it's still stable at the periphery here. And the root here is still stable. So that's good news. And so what that means, my friend, is we're going to trim this part because this part won't hold the stitch. Just to give you an idea, when we put a stitch in, it's to repair the meniscal tears, here we go, that are basically back in this region, where we can put a stitch here and the other there. But see, there's no place to, our stitch would go right there, which means this piece would be out of the way anyway. So let me show you how little we have to take out. This is good news because the recovery will be quicker for you and you shouldn't miss this little piece of meniscus. This is actually, like we talked about in the office, this is actually what my meniscectomy looked like, what my meniscal tear looked like. We've made some nice PRP. We're still going to do that because that'll help the knee. But with just a couple bites, grasper. With just a couple bites, we can have that meniscus cleaned up. Grasper. We'll put the shaver back in here. Okay, and you can see how that's all we have to do there. That meniscus won't grow back there. Now I want to fine tune this so nothing else tears in the future, but we're essentially done with the partial meniscectomy already. Okay, so we've taken out that little flap tear. We've left the rest of the meniscus, as you can see. Even some of the posterior horn, we weren't able to, did not have to resect that. So we're going to finish up there. The cartilage surfaces look great. Here's the central part of your knee. This is where the cruciate ligaments live. So anterior cruciate ligaments right back there. There's a little thing called the ligamentum mucosum that often blocks our view, but actually we can see pretty well there. It's the ligamentum right there. Okay, so I don't see any reason to mess with that. That looks great. Okay, so this is now the lateral compartment, and this side looks pretty good. Meniscus, that's what a normal meniscus looks like. See, its inner edge is nice and smooth. A little bit of radial tearing. That's really, it's not, with suction on the shaver, it's not displacing at all, so that's normal. We can look back here and see the popliteus tendon running up towards 11 o'clock on the screen behind the meniscus. That's normal. All looks great. So we're going to go up and look at the patellofemoral compartment last. And you can see you've got a little bit of a fissure right down the middle of the trochlea. Right here. See that? Now that's pretty small. So I don't think you have to do anything for it other than make sure the cartilage isn't super loose. This is one of the reasons why I think the PRP injection will help you, because it'll help firm this up and prevent some of this from becoming a bigger injury. You've got kind of a kissing lesion on the patella up at the top of the screen here. Right up there. But again, you haven't lost any significant amount of cartilage. So I don't want to mess with this at all. We just want to do our PRP injection at the end to help that, hopefully long term. This will be the end of our video. Good luck to you now. Bye-bye.